Good afternoon. I'm Steve Rehorst, one of the public information officers with the Watertown Area Task Force. Before we begin, I'd like to remind everyone today that the food distribution is going to be taking place this afternoon at 4 o'clock. And for that, what you want to do is you'll want to line up starting at Highway 81 and Arrow Avenue, and you're going to go east on Arrow Avenue to 9th Street, where someone will direct you north to the Boys and Girls Club where the event will take place. There's going to be no access to the Boys and Girls Club from 3rd Avenue, and we encourage you to not line up before 4 o'clock p.m. The event will start at 4 o'clock, and it will go as long as supplies last. Again, that is the food distribution today up at the Watertown Boys and Girls Club, starting in about a half hour at 4 o'clock. We'll begin our briefing today now with our first speaker, which is Mayor Karen, with a community update.
Good afternoon. Today is April 30th, 2020. In our state of South Dakota, we now have 2,449 cases, and we're up to 17 deaths. Cottington County remains the same with 14 cases, 13 of them recovered. Governor Noem recently did an executive order directing all South Dakotans to follow her back to normal plan. The gating criteria for Cottington County is that we must have no active cases in order to qualify to initiate the governor's plan. We still have one active case, so Cottington County does not qualify to initiate the plan. So what are the rules? In the absence of a city ordinance or state guidelines, I urge everyone to follow the CDC guidelines. This means wash your hands, avoid crowds, follow the social distance requirements, 6 feet between people, and do good housekeeping practices. This is all pretty simple, and if we all maintain this, we will maintain control of this disease in our community. So for restaurants, since we recently allowed restaurants to open back up and bars, we're getting a lot of calls about how many people can they have in their business at one time. So there is no CDC guidance on restaurants, and I would recommend that restaurant owners instead use the National Restaurant Association reopening guidance. You can find this on our COVID website, on Facebook, or on the city website. So it's all common sense, just to have a knowledgeable person on site at all times and to do the basic housekeeping and disinfection routine. So if we don't manage this properly, we may backslide, and that could cause a significant outbreak. So people are asking about the 10-person rule. Can I have more than 10 people? There is no number that is listed for an organization. The CDC says eliminate gatherings of 10 or more when a separation of at least 6 feet is not possible. So really the main thing is, can you maintain 6 feet between other human beings? That's really important. So it all seems confusing and everything's changing. I agree with Governor Noem that all people need to be personally responsible, and then we'll be fine. And so looking forward to keeping that going. So that's all I have to say. Just remind you about the food giveaway at 4 o'clock today. And we have 2 guests today. We have Marcy Cole from Glacial Lakes Energy and Carrie Dilla from Human Service Agency. And Marcy will be up first.
Good afternoon. I'm Marcy Cole from Glacial Lakes Energy. I'm the Director of Communications and Corporate Affairs. About a month ago, I was here talking about the partnership that Lake Area Technical Institute and Glacial Lakes Energy had established to provide hand sanitizer. So today I just wanted to give an update where we're at and a few reminders. Today we have donated over 3,700 gallons of hand sanitizer, not only to Cottington County, but to the state of South Dakota. This is provided to medical professionals and first responders at no charge. Glacial Lakes Energy provides the 3 ingredients to make the product, and Lake Area Tech mixes it and helps with distribution. This is a partnership that we are pretty proud of, and we want to continue to support those in need. So if you are from the medical profession, clinic, hospital, daycare, nursing home, or first responder, give me a call at 882-8480, and we will get you hooked up with hand sanitizer, which again is free of charge. We are not providing or selling it to the general public or the private sector, as our focus is on helping the medical community. We are proud to be supportive in this time of need. And again, if you need product, give me a call, 882-8480. Now I will turn it over to Carrie Dilla from the Human Service Agency.
Thank you, Marcy. I'm Carrie Della. I'm the physician assistant at Human Service Agency. My role there is to manage and maintain patients' need for and progress on long-term psychiatric medications. When I agreed to do this, it was a few weeks ago, and I jotted down some notes, some things I thought I should cover then, and I now feel like that was very long ago, and we're all very different people now than we were just a few weeks ago in terms of the pandemic. So last night when I was reviewing that, I felt as though that really is what I need to talk about, and that is change, and how we deal with change, and what we can do to help each other with that, and what myself as a mental health care provider can do to help you. As we know, the situation with the pandemic has been fluid, the term that seems to be used most frequently when we talk about it. And that's difficult. Fluidity or change typically causes stress. Stress is normal. It's a normal physiological and psychological reaction to the demands of life. I think everybody has experienced it somewhat here recently, but everybody experiences it a little bit differently. It's normal to feel this way during a crisis, but multiple challenges every single day, such as those that we've had with COVID-19, tend to press us beyond our ability to cope. When we talk about coping, we talk about ways that we can take better care of ourselves. And I know Mayor Karen has reminded us of some of those during these updates. Carrie Johnston, our CEO from HSA, has been here and reviewed some of those. If you do reach out, ones that I like to visit about with my patients in my office are some of the major ones. Sleep. Are you sleeping? Are you getting enough sleep? Most of our schedules and routine have been very different. Here now recently, it's important to still go to bed at about the same time every night and get up at about the same time every day. It seems very simple, but it's an easy one to get off track with. I always tell my patients, the brain needs sleep. I say it several times a day, and it really is just very, very important. Another thing that we talk about is participating in activity, getting enough activity. That's a little tough to do when we've been stuck at home for a while. I know that's starting to change. Some of us have been without our gym or our workout facility. That's starting to change. We've had to be a little bit creative, but we have some nice weather now too that hopefully will help us with that. Whatever you can do to keep yourself going in that regard, joining a challenge group, working out with your kids, those things tend to make us feel a lot better. Another challenge that a lot of my patients have brought up to me here recently that we end up talking about is limiting our screen time, whether it be TV or social media. We love it. We love Facebook. It brings us these updates like the one that we're doing here right now. We love to connect with our friends and family that way, but it can be a tough spot to be right now too. It can be a place for people to let out some stress and be unkind, and sometimes we just have to get away from it. Take the app off of your phone, replace it with another app if you need to. We need to be really careful about what we're exposing ourselves to with that. So we'll talk about these coping strategies that we need to help deal with stress. And with my patients, sometimes, despite our very best efforts, we still end up feeling helpless, sad, angry, irritable, hopeless, or afraid. You may have trouble completing tasks or getting done with just normal daily activities. And these are symptoms that will lead us to a discussion on anxiety. When these symptoms last beyond days and you cannot carry out your regular responsibilities, when your relationships start to suffer, it's time to ask for help. Typically, the DSM-5 specifies anxiety to qualify for a formal diagnosis as lasting more than 6 months. But these are very unusual times that we're in right now, and it has us reevaluating our strategies as far as that goes. Sometimes the severity of those symptoms well indicates doing something sooner, and we can talk about this. We can talk about your family history. We can talk about other risk factors. When we meet, we can also identify other areas of need that you might have, whether it be the need for counseling or chemical dependency treatment. If you reach out to your primary provider or a mental health provider such as myself, we can also discuss safe medications that are available to help regulate this disruption in your central nervous system. We have many options. I know a couple of months ago, before we got to the point that we are now, it's become less of a concern, but there was some talk about lack of medication availability. Would we even have the medications? Would pharmacies have difficulties getting them? Would pharmacies have difficulties distributing medications to their patients? And I have to say with confidence that I really have had zero issues of that nature. If cost is an issue, we have programs available that can help pay for those medications for you, so don't let that be a hindering factor. If you had been on a medication at one time and stopped it because you couldn't afford it, reach out. We have a lot of programs and strategies that we can work through and around those things for you. So don't let any of those things be hindering factors for you. Very safe options. At times I will have a patient reach out. We talk about the medications available. We talk about the indications, the safety factors, and they will say, you know what, Carrie, I'm just not ready. I don't think I want to start a medication, and that's fine too. Sometimes it's helpful just to know what options are out there. In order to reach out, if you're unsure of how to go about that, you can refer to the COVID page that we're on here right now. That's laid out very nicely. Most of the resources are listed. We've got the 211, the crisis line. You can surely always call your primary provider at Brown or Sanford. And surely you can call us at HSA 886-0123. Right now, we are still not seeing patients in-house. In our effort to keep everybody safe and well, we are conducting our visits remotely. We've worked very hard to do that. We have options for you. You can visit with me via telephone, or we also have it set up via Zoom if you like the idea of having a face-to-face, so to speak, visit from a distance. We've worked really hard to hustle and set it up so it's very much like being in my office. You start with my nurse. She goes through your medications and your health history, and then I enter the room, so to speak, and we complete our visit that way. So I feel very confident that we're still very available to you to offer the very best care we can during this time. So do reach out. We know that we can expect some of these strong feelings to fade once the pandemic is over, and it will be over. So let's try to stay busy. Let's try to just get through the day. Focus on positive thoughts when you can, be kind to each other, and do a good job of taking care of ourselves and each other. Thank you. I will turn it over to Jennifer.
Thanks, Carrie, Marcy, and Mayor Karen. Are there any questions from the media today?
Jennifer Troy with KXLG for the mayor, please.
Good afternoon.
Good afternoon, Mayor. We've been hearing some talk throughout the community today and in our newsroom about some layoffs at a plant here in Watertown. Without giving the name of the plant because they haven't officially released any type of media announcement on that yet. Are you familiar with what I'm referring to? Have you heard anything yet?
I have, and I know there's some people in our community that are going to be struggling, and my heart goes out to them. But I can't speak about that. I don't have firsthand knowledge.
Okay, thank you.
Mm-hmm.
Are there any more questions today? No? All right, thank you everyone for joining us today. A kind reminder to keep following those CDC guidelines during this time. Enjoy that warm weather, and we will see you again tomorrow at 3 o'clock. Have a great evening.